The CDC is confirming the first case of the Ebola virus diagnosed in the U.S. and in Texas. Dallas County Health and Human Services says the patient arrived in the U.S. on September 20th and began showing signs of illness 4 days later. For that reason, officials at the Centers for Disease Control say they are not concerned with other passengers on that flight. The hospital says it is following all Centers for Disease Control and Texas Department of Health recommendations. There are no plans to transfer this patient to a specialized hospital with a biocontainment unit at this time. And with the first Ebola virus case diagnosed so close to home, you might be wondering if the virus could end up here in Southeast Texas. KFDM's Justin Hinton joins us with that part of the story. Justin?
Kelly, as you said, doctors admitted the patient to Texas Health Presbyterian Hospital in Dallas. The test was conducted at the State Public Health Laboratory in Austin. And in Southeast Texas, you might be wondering whether the virus could end up here. One infection practitioner says it could.
We're only a plane flight away from everywhere.
That's what increases the potential for viruses like Ebola to make their way to the U.S. or even to Southeast Texas.
Could we see a case? We could. It's a small risk, but we could see a case.
But Cindy Powers, an infection practitioner with Christus Hospital, says widespread transmission in the U.S. is not likely. That's because Ebola is spread through direct contact with blood or other bodily fluids of someone infected or exposure to contaminated objects.
Our exposure to blood and body fluids is much different in the United States and certainly different in a hospital setting.
Even still, at Christus, they've taken extra precautions in the past few months.
We've notified our providers, our doctors and nurse practitioners at our clinics and ERs to make sure that they're aware that they could see an Ebola case. And so they need to knock that suspicion up a notch.
Meaning, ask about travel history. Red flags should go up if patients say they recently went to Sierra Leone, Guinea, Liberia, or some parts of Nigeria. Any possibilities of Ebola moving from Dallas to Southeast Texas, Powers stressed that is not likely. She says the hospital has ramped up its efforts over the past few months to prepare should someone come in with symptoms of the virus. Kelly?